Good morning, my name is Dr. Jeremy McAnulty from New South Wales Health, and this is a live stream update for COVID for New South Wales in the 24 hours to 8 o'clock last night. In that period, there were 477 locally acquired cases of COVID-19 reported in New South Wales in the 24 hours to 8 o'clock last night. In the same period, there were 86,155 COVID tests reported. In terms of vaccination, New South Wales has reached a milestone with 90% of its residents aged 16 and over now having received their first dose of COVID vaccine. Across New South Wales, 90.1% of that population have had one dose, and 72.8% are now fully vaccinated. The number of vaccines administered in New South Wales is now approaching 11 million. This is fantastic. Thanks so much for everyone in the community for coming forward and continuing to get vaccinated and get our vaccination rates up across New South Wales. In terms of hospitalisations, there are currently 794 people in hospital with COVID in New South Wales, including 159 in intensive care, 76 of whom require ventilation. Of the 159 people in intensive care, 114 are not vaccinated, 30 have received one dose of vaccine, and 15 have received 2 doses of vaccine. There are a number of suburbs of concern where we're seeing the highest numbers of cases. In New South Wales, this includes Merrylands, Rooty Hill, Warrawong, Dee Why, Mount Druitt, Tarrawanna, Cranebrook, Campbelltown and Yagoona. Sadly, we're reporting the deaths of 6 people or men who had COVID-19. 2 are in their 50s, 1 in their 60s and 3 in their 70s. One of the men was from Western Sydney, 2 from south-western Sydney, 2 from southern New South Wales and 1 from south-eastern Sydney. 5 were not vaccinated and 1 had received 1 dose of vaccine. A man in his 70s died at St George Hospital where he acquired the infection. It's the 3rd death linked to an outbreak at the hospital. A man in his 50s from southern New South Wales died at home. A man in his 50s from southern New South Wales died at Canberra Hospital. A man in his 70s died at Nepean Hospital where he acquired the infection. Here's the 8th death linked to an outbreak at the hospital. We'd like to extend our deep sympathy and condolences to the families and loved ones of these people who've sadly died with COVID. There have been 431 COVID-related deaths in New South Wales since the 16th of June this year and 487 since the beginning of the pandemic last year. In terms of sewerage, our ongoing surveillance system for fragments of the virus that causes COVID have identified evidence of the virus in Uralla, in the Hunter New England region, where we've got no known cases of COVID. So anyone who lives in Uralla or has been there recently is urged to watch particularly carefully for symptoms and come forward for testing should any occur. New South Wales Health is continuing to investigate the source of a Delta strain with a slightly different genome to the sequence that's currently circulating in Sydney. However, there's no indication that this new strain presents any difference regarding transmission or the effectiveness of the vaccine. There are currently 8 cases identified with this new strain, 7 people in one household and another person, and we're continuing to investigate the source and how transmission may have occurred. In terms of regions, in terms of cases reported to 8 o'clock last night, in the previous day, there were in the Hunter, New England, there have been 56 new cases reported, including 16 in Lake Macquarie, LGA, 15 in Cessnock, LGA, 7 in Tamworth, 6 Newcastle, LGA, 4 Maitland, LGA, 3 in the Mid-Coast, LGA, 2 in Singleton, LGA, 2 in Port Stephens, LGA, and 1 in the Upper Hunter, LGA. In the Illawarra, there are 58 new cases reported, including 35 from the Wollongong, LGA, 11 from Shoalhaven, LGA, and 12 from Shell Harbour, LGA. In the far west, 1 case has been reported yesterday in a person from Dareton. On the Central Coast, 25 new cases have been reported. In southern New South Wales, 11 new cases, including 4 from the Queanbeyan Pellerang region, 4 from Snorri Monaro region, 2 from Goulburn and 1 from the Bega Valley region. In Western New South Wales, 17 new cases were reported, including 5 from Walgett, 5 in Wellington, 3 in Bourke, 3 in Cowra and 1 in Dubbo. In Northern New South Wales, 5 new cases were reported, including 2 in the Richmond LGA, 2 in Kyogle LGA and 1 in the Ballina LGA. In the Murrumbidgee, 1 new case was reported in the Wagga Wagga LGA. And on the Mid-North Coast, there were no new cases reported to 8 o'clock last night. So thanks very much everyone for coming forward for vaccination and continuing to come forward for testing if you get even the mildest of symptoms. These measures are particularly important as we begin to open up. We all need to maintain those COVID-safe behaviours that we've been using for the last year and a half. You know, good hygiene, covering coughs, wearing masks where you need to, making sure you come forward for testing. Importantly, get tested if you have any symptoms at all, and importantly, encourage your friends and family to get vaccinated so we can get everyone in the community vaccinated who is eligible. The more people we get vaccinated, the more safer we'll be. So thanks very much, everyone.